Hello, I'm Jack Smith. As superintendent of Montgomery County Public Schools, I'm not only concerned with the education of all of our children, but their health and well-being too. That's why I wanted to speak to you today about an alarming problem affecting our community and this state. Opioid use is the fastest growing type of drug in the U.S. today, and it knows no boundaries, with the potential to kill both adults and our youth. Opioids can range from illegal heroin to synthetics such as fentanyl to prescribed pain relievers such as oxycodone, Vicodin, and morphine. The strength of these drugs can often lead to abuse and addiction. According to the U.S. Drug Enforcement Administration, overdose deaths, particularly from prescription drugs and heroin, have reached, quote, epidemic levels. In 2015, 52,000 Americans died from drug overdoses, with about 2/3 of them coming from the misuse of opioids. Here in Maryland, during the first 9 months of 2016, there were more than 1,500 deaths from opioid overdose. According to the Maryland Department of Health and Mental Hygiene, that was a 66% increase from the year before. Montgomery County is not immune to this epidemic. The same data reports 84 opioid deaths in 2016 compared to 59 in 2015. The problem is so striking, Governor Larry Hogan has declared a state of emergency to combat it, committing $50 million over 5 years to beef up enforcement, prevention, and treatment services.
Hello, I'm Dr. Raymond Kroll, Chief of Behavioral Health and Crisis Services with the Montgomery County Department of Health and Human Services. The growing problem of opioid abuse has meant that we all need to educate ourselves, not only what it is, but what we can do to help those impacted. So, I want to share with you some of the signs of abuse, intoxication, and overdose related to this class of drugs. Early warning signs of drug or opioid abuse include heightened secrecy, fishy-sounding excuses or outright lying, difficulty thinking or keeping focus, withdrawing from classroom participation, resistance to discipline or feedback, increased tardiness or absence, paranoia, irritability, anxiety, fidgeting, changes in mood or attitude, significant weight loss or gain, loss of interest in hobbies or activities, decline in school performance, and abandonment of longtime peer groups. Some of the physical signs of opiate or drug intoxication are noticeable elation or euphoria, marked sedation or drowsiness, confusion, constricted pupils, slowed breathing, intermittent nodding off or loss of consciousness. Signs of an actual overdose may include labored breathing, difficulty breathing or shallow breathing, clammy skin, lips, fingers, or face beginning to turn blue, limp body, vomiting, pinpoint pupils, convulsions, cannot wake. In severe cases, breathing may stop as well as the heart. If you suspect someone has overdosed, call 911 immediately. Don't be afraid to help. The Good Samaritan law protects those who provide assistance for a person experiencing an alcohol or drug-related medical emergency. If you suspect someone has an abuse problem, seek help. Find an expert to help the person you suspect has a drug abuse problem. Start with the Montgomery County Health and Human Services Department. Its Substance Abuse Screening and Referral Unit can be reached at 240-777-1770. If you suspect someone has overdosed, call 911 immediately.
And in our schools, due to the increasing threat of opioid abuse in this state and local community, and because it's required by Maryland state law, MCPS will be keeping the lock zone in every county school. School health staff will be trained to recognize narcotic overdose and will be trained to administer this life-saving medicine if necessary. I encourage you to talk to your kids in a non-judgmental way. Bring up the subject of drug abuse. Find out what they know and make sure they understand the impact that drugs can have on them physically, academically, legally, and emotionally. Being aware, knowing the signs of addiction and abuse may just save a life. Thank you for all you do to keep our students safe.